I'd like to address the question of what the juvenile justice system can do to help reduce the excessive rate of crime and incarceration among adults. On the one hand, it looks like this should be very straightforward. 80% of adult offenders first appeared in the juvenile justice system. It follows then that if some effective intervention that reduced their criminal behavior took place in the juvenile justice system, fewer of them would then go forward into the adult system, and we would have less crime and less incarceration. But it's a little trickier than that, because while a high proportion of adult offenders first came into the juvenile justice system, most of the kids in the juvenile justice system are not on a pathway to adult offenses. Most of them, approximately 80% of them, are essentially afflicted by adolescence and are in a transitory developmental period and that they will age out of. This presents real challenges for the juvenile justice system. What the system must do is first somehow distinguish those that are on trajectories for serious and violent crime and treat them appropriately. And there are good tools in the juvenile justice system. The juvenile justice system is much more oriented toward treatment and rehabilitation than the adult system. And the period of adolescence is one largely of plasticity and potential responsiveness to treatment. So there are powerful opportunities there. On the other hand, for those juveniles who are not on trajectories toward serious violent or chronic crime, there's increasing evidence that participation in the juvenile justice system does not do them any good and may even be harmful, particularly if they're overtreated or over-supervised. So on the one hand, the system has to do no harm for those who are not on serious trajectories. On the other hand, identify those who are on serious trajectories and try and intervene early. So how can this be done? Well, 20 years ago, I think it would be a very difficult proposition. Currently, though, we have research, not research that tells us everything we might want to know, but research that tells us a lot more than we're practicing right now. And there's some critical lines of this research. One is longitudinal studies that trace the trajectories and development of delinquent and criminal behavior. And it's clear that there are various pathways to serious crime, with many juveniles starting on the front end in adolescent experimentation and impulse and risky behavior, relatively few coming out the back end as serious criminals. And along the way, there are many predictors and risk factors that help identify who's on a serious trajectory and who's not. This translates into risk assessment schemes and instruments that can determine the probability, not determine, but estimate the probability from fairly early ages that a juvenile might be a serious case and might need additional attention. Another important line of research has to do with the effectiveness of intervention with juveniles. In the early 70s and 80s, the prevailing wisdom was that intervention really was not effective with delinquents and criminals, the so-called nothing works hypothesis. We have a large accumulation of studies since then that show quite the contrary. So we do have effective interventions that, at least in the research, have shown to reduce recidivism by 20, 30, sometimes even 40%. So there are effective tools there. So how does the juvenile justice system actually then implement apply this research? It's not simply sufficient to have that research and that information available. People in the juvenile and criminal justice system have other things to do besides sitting around reading the academic journals and figuring out how to translate that into practice. So it's very important to have bridging tools that go from research to practice. And in juvenile delinquent systems, the important bridging tools come under the label of structured decision-making tools. That is, various kinds of instruments and procedures that can be used routinely as part of policy that have the effect of translating research into practice. So systematic risk assessment to determine the appropriate level of supervision and treatment. Disposition matrices, something like what would be sentencing guidelines in the adult system that help guide appropriate decision making as to the appropriate level of treatment and service. Needs assessment schemes that identify those criminogenic risk factors in mental health problems that can propel delinquency, and schemes that allow quality control to assure effective interventions. So a data-driven and evidence-based juvenile justice system would be built around systematic risk assessment, needs assessment, disposition matrices, effective interventions in ways that were built into policy and practice and became routine, with the effect of changing the probabilities, not curing crime and delinquency, not identifying every individual who has a potential for serious criminality, because we're not able to do that. But at a system level, at a large population level, the probabilities can be changed appreciably. How does this happen? My team is currently working with 10 state juvenile justice systems on various reform initiatives, and there's a pretty straightforward sequence that involves leadership that has a vision for doing things better, technical assistance and training to bring in these tools from people who know how to use them and can train on those, implementation in policy, reinvestment strategies from legislature or systems in which savings on the high end, fewer arrests, fewer incarcerations, translate back into greater investments into prevention and early treatment, and ideally statutory support for the whole process. And we have a number of states now that have evidence-based practice laws that require that these research-based practices be used. Oregon, Tennessee, Georgia, North Carolina, and so on, with the net effect that we're seeing a wave of juvenile justice reform that promises to not only better treat the adolescents who are just passing through the system, but better identify and reduce the reoffense rates of those unfortunate kids who are on trajectories for serious criminal behavior. Thanks.